Sì. La domanda che volevo porre alla dottoressa Rogers è relativa appunto alla sempre maggiore convinzione che ci stiamo formando sulla possibilità di incidere dall'esterno, soltanto modificando le condizioni di stimolo ambientali, modificando soprattutto la qualità della relazione all'interno della diade, possibilità di incidere sulle connessioni cerebrali. Questo sembra una cosa assolutamente stratosferica, quasi sa tanto di magia, come senza farmaci, senza nessun intervento chirurgico, possiamo entrare nella testa del bambino e possiamo modificare le sue connessioni, possiamo influire sui meccanismi di pruning, possiamo influire non soltanto sul pruning, ma probabilmente anche nel modificare quello squilibrio tra connessioni a lungo raggio e connessioni intraregionali, squilibrio che probabilmente sembra essere appunto alla base delle condizioni di tipo autistico. Questa era la domanda che appunto volevo porre alla professoressa Rogers, che nella sua relazione aveva giustamente sottolineato questo aspetto. È possibile veramente fare questo? Modificare la biologia?
You mentioned in your discussion that we can modify the input that we provide to children. Should I? I'm gonna. Well, it was probably translated. So, well, the question is about whether, by modifying the input that we provide to children with autism, we can actually modify the biology of the brain of children with autism. And the question is, are we addressing, by providing a different modified input, the problem of abnormal connectivity in children with autism? And what do we know about how teaching changes the specific brain abnormalities of autism, which involve difficulties in connectivity between different areas?
Well, the brain changes that I was talking about, coming from the dyslexia literature, are directly related to connectivity. So changes in myelination, improvements or increases in myelination, are changes, are improvements in building of brain connectivity. So yes, there is evidence, at least from other literatures, that it's possible to increase brain connectivity, pruning by activating long-range connections in the kinds of interactions that we have, as opposed to focusing on short-range connections. Activities like joint attention behavior and imitation involve many, many coordinated brain centers. The fMRI studies of imitation and joint attention demonstrate the whole brain lights up in people who are carrying out these activities. It requires long-term connections and synchrony integration across many different brain centers at once. So I think it stands to reason, although we don't have evidence in autism yet, that carrying out activities which involve long-range connectivity, multiple integrated activities, and more complex activities should result in more complex neural networks, increased myelination if the dyslexia literature is generalizable, and the development of the kinds of connections that underlie those skills.
Thank you. Shall we go ahead? Okay, well, we have a question for Dr. Lori Wismara. And the first question is about, do you think it's possible to do clinical evaluations such as the ADAS online? Yeah, or you can actually...
I think that's a very timely question. I think I think it is possible. Dr. Lord is here. I know she's presenting on Sunday, and so as the main developer of the ADOS, I would actually want to pose that question to her myself. But I think that we need to consider. I don't want to, not necessarily changing the core of these instruments, but again, figuring out ways to get them to families. We can't, I don't think we can continue with such extensive, involved diagnostic procedures because of, again, how lengthy they are, how expensive they are. So I think trying to figure out how telemedicine might enhance the quality of services, again, but without taking away or detracting from the specificity and sensitivity that measures like the ADOS have. But one of my personal questions has been whether, we can develop a telemedicine approach to assessment and intervention. So I hope so. Do you want to add?
Thank you, Laurie. Next question is for Dr. Josephine Barbaro. So what kind of training the nurses were exposed to prior to the start of the surveillance of your project?
Okay, so Cheryl Dissanayake, myself, and Lael Ridgway, who was a maternal child health nurse, went to each of the local government areas, 17 of them, they were councils, and we went to their meeting and did a half-day workshop in which we went through the specific early signs of autism with the nurses, as well as the typically developing milestones that children meet in relation to their age. So these nurses are already very well trained in typical development, and the specific signs that we used were already part of the healthcare checks. We actually have a book in which parents bring to their nurses at every check. And within this book, it has specific milestones that they look for. And what we actually did is we picked out each of the behaviours that were specific to autism and then said to the nurses that if any of these behaviours were deficit or absent, inconsistent, as long as they met criteria, for example, 3 of the 4 behaviours that we outlined were deficient, then they were at risk for autism. So, and then after the completion of the study, I then went to each of the councils again and then presented the information that I did today on the very specific behaviours. So which of the behaviours they monitored were the most specific for autism, so that they could then bring that into their practice as well.
Thank you, Josephine. And we have another question for either Dr. Wismar or Professor Rogers. Is what about the possibility to have online model of training in language other than English?
There's no problem in someone developing this. It just needs to be done. We are translating the manual into several languages, and it just needs somebody to do the work, make the videos, and translate the parent manuals. We would be very happy for other people to do that, and we'd be glad to help select the videos to make sure that they represent the points. I think that would be great.
And in relation to this, the other question was about the evidence of the ESDM effectiveness in other language formats, and how about can the telemedicine version of it can it be translated or adapted to different countries or different languages?
It hasn't been tested in languages other than English yet.
Thank you. Any other questions, remarks, comments, criticisms? Yes. No.
I just wanted to know if you think that the Early Start Denver model can come to complete an early intervention ABA home program, for instance, because a lot of parents have the feeling that more typical ABA programs, which are more available in Europe, for instance, lack quality as far as teaching play and teaching natural social interaction. So do you think that distant Denver model parental teaching can complete an ABA program?
Sure. It's certainly possible to add this to what you mean, like a discrete trial teaching program?
Not totally discrete trial teaching, more discrete trial teaching completed by a NET program. But some programs more available here in Europe and would benefit from this more natural approach.
Yeah.
And people here, it's easier to find someone who's trained in ABA, even though it is difficult to find someone trained in ABA here in Europe than someone who's even aware of the Denver model. So do you think that both models can complete each other?
You know, it's an empirical question. I know in the States there is certainly a practice of combining discrete trial teaching with floor time, for instance. Parents like to put both of them together. We don't have any evidence to say that that's more effective than one model or the other model. And you do also run this risk of spending 4 hours a day reinforcing children for not initiating during their DTT periods, and then changing the rules so that now they're getting reinforced for initiating. You don't know what the effect of that is. Kids are pretty specific learners, so they probably can do that. But, you know, we need some of the young people in this room to do these studies and figure out whether it enhances development to mix models like that or whether it doesn't.
Okay. Thank you.
You want to comment on this? No? Okay. Any other question? Yes, please. Yeah.
Thank you. I was very interested in Dr. Josephine Barbaro's presentation about the pretend play not being very specific about pretend play. Yes. You mentioned that pretend play was about like 42% of children with autism displayed this behavior, was not very specific and very, very interesting. Yes. And my question is related to the fact that as I'm a clinician belonging to a team where we see a lot of children with autism, and we use an instrument called the MChat, on which you can find an item where about pretend play. They give an example, for example, talking on the phone or playing with the door or something like that, feeding the door. And our impression is that talking on the phone is not exactly specific. And we decided collectively not to use this in particular as an example because it's completely, to our sense, first-degree imitation. You know, it's just or first-degree, how to say, the child sees what's happening with the phone and just replicates it. Yes. But there's no creativity. No. I just wanted to know what was the question, if there's an example in this item we use, if you use another way to assess pretend play, and if you have any comment about this.
Okay, so you're asking the pretend play item, how the nurses actually did this particular item, is that correct? How they actually elicited the behaviour. So, we actually instructed nurses not to, first of all, show the child first. So we gave them 2 examples that they could use, which was pouring a cup of tea or feeding a teddy. And we instructed nurses to not first show the child because, then they could then copy them. So that is what we actually did. And in the ADOS, it was also like that as well, because what we actually did is that the nurses filled out their sheet with, for example, items like pretend play, and then I filled out the exact same sheet with the assessment that I did in the lab, and I made sure that I didn't first show the children, and it was the pretend play item in the ADOS, which was the pouring a cup of tea.
Bene, io ringrazio tutti i relatori e tutti coloro che hanno assistito fino a questo momento di questo simposio così ricco, così interessante e sicuramente con tanti messaggi che porteremo poi nella nostra pratica clinica quotidiana. Grazie a tutti e grazie ai relatori.